2025 Medicare Part D drug plan benefit changes. Hello, I am Kevin Canals, an independent health insurance agent in California. And for 2025, the Part D drug plans are changing. And this change applies to standalone Part D drug plans that you may have with original Medicare, or the Part D prescription drug coverage embedded in a Medicare Advantage plan, because the drug coverage is kind of separate from the health benefits in the Medicare Advantage plans. This video is part one of two because there's a lot to talk about. The first significant change is that there is now a $2,000 maximum out-of-pocket amount for the individual, the plan member. So when the drug costs have reached $2,000 for that individual, they have hit the catastrophic phase, and everything, all the drugs are zero cost, the drugs that are on the formulary. Another significant change is that there will no longer be a coverage gap or donut hole within the plan structure. So you're going to go straight into the initial coverage and go all the way to the catastrophic phase. And then there is a new Medicare prescription payment plan. And that's a little bit complicated, and I'm going to reserve talking about that more in part two of this video series. Medicare establishes a standard structure for the Part D drug plans. And the standard structure for 2025 is that it starts off with a $590 deductible. So you must pay $590 over-the-counter list price for the drugs. And then once you have met $590, you go into the initial coverage phase, where the drug costs drop to 25% of the list price. And then when the deductible in the initial coverage phase, co-payments and co-insurance equals $2,000, you're done, and the plan covers those drugs 100% for the rest of the year. Now, Medicare allows the plan sponsors, the insurance companies, to create alternate designs. And as long as the alternate design is actuarially equivalent to the standard design, they allow it to go forward. So you may see some plans where there is no drug deductible. You go straight into co-payments and co-insurance, the initial coverage phase. Now, some of those co-insurance, they may be more than 25%. Maybe they might be 30 or 50% of the drug cost. And some other drugs will have a very low copay. But once all of that equals $2,000, you're done for the year. Another alternate drug structure that we have seen is where there is a drug deductible, but it only applies to certain drug tiers, because these drugs are broken up into tier 1, 2, 3, 4, 5. Tier 1 being your generics, tier 5 being your expensive specialty drugs. And some plans may have the drug deductible for tiers 3, 4, and 5, but not tiers 1 and 2. So if you have a tier 1 or 2 generic drug, you go straight into the co-payment or co-insurance phase. But if you are prescribed a tier 3, 4, or 5 drug, you will have to pay the full list price until you hit $590. Then you go into the initial coverage phase for those drugs, which is a copay or, co-insurance. This stuff is really complicated. So here is kind of an illustration of how this might look based on that last alternate drug structure. This individual takes two drugs. One is a tier 2 that has a $10 copayment, and then a tier 3 drug, which is in that deductible phase. So in January, they pay $10 for the tier 2 and the full list price for the tier 3 drug of $400. Their total for the month is $410. That accumulates to meeting the maximum out of pocket, and that $400 goes to satisfying the drug deductible. Month 2, February, again, $10 for the tier 2. But now, because of the cost of that tier 3, they've met the drug deductible, and they kind of split up the cost, so they don't pay the full amount. They're paying less than the $400, and it comes out to $305 for their drug costs. That accumulates to meeting their maximum out of pocket, which is now $715, and of course they have met their drug deductible. The third month, the tier 3 drugs for this particular plan is 50%. That's the co-insurance in the initial coverage phase. So tier 2 drug is $10, and the tier 3 drops to $200, 50% of the $400. And that goes on in April, and again in May, June, July, and August. And you can see those drug costs are accumulating towards meeting the maximum out of pocket. September comes along, and boom, they have met their maximum out of pocket, because in August, the maximum out of pocket accumulation was $1,975. They hit the $2,000, and the drug cost dropped for that month. But you will notice in October, November, and December, the drug costs are zero for the remainder of the year. So that's nice. That's nice. We don't know how this is all going to affect all of the different drug plans out there. So you really, really need to focus on what is called the annual notice of change that is sent to you by your plan, and or go to Medicare.gov and do some research, work with an agent. But here's some potential changes that we may see in some of these drug plans. The premiums may go up. Your premium may go up. The maximum out of pocket has gone down. So some drugs may be dropped. Now, the Part D drug plans have to have certain drugs and certain classifications, but they don't have to have every drug. So they may drop some drugs from the formulary, and if that happens to be one of your drugs, you may need to look for another drug plan. Some drugs may move up in tiers. Perhaps you were taking a drug that was tier 2, maybe it might be moved to tier 3 or tier 4 for the next year. And there may be higher co-insurance. So sometimes there might be a co-insurance of 25 or 30% for some drugs. Those may go up to 40 or 50%. So you'll have to make note of that. And there may be higher costs for using a standard versus a preferred pharmacy. So you want to make sure that if your Part D drug plan has a preferred pharmacy network, that you're in that, you're visiting a pharmacy in the preferred network. Other changes that we may not see on the front end that may happen on the back end is some of the drug plans may tighten up those formulary exceptions in terms of perhaps you have been prescribed a drug that is not on the drug formulary. You can ask for an exception, and then they will add it to the drug formulary. I've had many clients do that. But, in 2025, they may tighten that up. They may not be as liberal on those policies. There's also the drug exception of requesting the drug plan to take maybe a tier 4 drug down to tier 3 for you to help on the costs. They may be a little bit more reluctant to do that because, again, there is a lower maximum out of pocket for 2025. They may have tighter restrictions on prior authorization and adhere more closely to the step therapy. So if you develop an illness, the doctor prescribes you a brand name drug, the plan sponsor is within their rights to say, no, you need to start with this generic version first, which is much less expensive, and then matriculate up to that brand name drug if those other generic alternatives are not as efficacious in treating your particular drug, your particular illness. So there's a lot to be on the lookout for. There's a lot of good things in the 2025 changes to the Part D drug plans, but there's also some stuff that if you're not careful, you may get hit with. In Part 2, I will be talking about this prescription payment plan and how that works. If you have any questions or comments about Part 1 of this 2025 Part D drug plan review, you may leave those down below and I'll do my best to answer them. Otherwise, for InsureMeKevin.com, I am Kevin Knaus.